Welcome to Care Anywhere, the podcast brought to you by TruMerit, formerly CGF&S International. If you're hearing that for the first time, you can find out more about our new name and why we changed it at trumerit.org/new name. That's TruMerit, TRUMERIT. We are expanding our mission and services beyond nurse migration to address the skills portability, career mobility, and career advancement of global health workers. To that end, I'm talking today to Earl Dalton, career nurse and chief clinical officer for Health Carousel. Earl shares his experience as a global nurse and his passion for the work he does today, investing in health worker development around the world. Health Carousel is serious about the career pathways of nurses all around the world, whether in country or migrating. So stick around. A great episode is coming right up. Across global health systems, health workers on the front lines of care delivery are carrying more on their shoulders today than ever before. Workforce shortages are increasing, scope of practice is shifting, and skill sets are definitely evolving. In this podcast, we're setting the table for some powerful discussions with nurses, allied health professionals, regulators, tech innovators, and other thought leaders across the globe. Together, we're diving deep on the challenges and opportunities that loom large for recruiting, training, and equipping the health worker of the future. Welcome to Care Anywhere, the Global Health Workforce Podcast, brought to you by TruMerit, formerly CGF&S International. Hi, everybody. Welcome back to Care Anywhere. It's great to see you. Excited about today's episode. I am joined today by Earl Dalton, who's the Chief Nurse Information Officer and Chief Clinical Officer with Health Carousel, and we're going to have a great conversation about workforce development for health workers. Earl, welcome to the show. So glad to have you.
Thank you, Lea.
I'm going to open by asking you the same question I ask everyone on this podcast who is a health worker, especially if they have a nursing background. What inspired you to become a nurse? So I'm always interested, and so are the members of our audience who are at various stages of their career. How did you get started? What interested you in healthcare, and how did you pursue this as a career passion?
Yeah, great question, Lea. Thank you for that. As a male, right off the bat, it's a non-traditional role, right?
Sure.
And certainly, if you knew my background, having grown up in northern Canada, I would even be more non-traditional. There's a lot of sort of marine fishermen type folks in my family and my background. And so it is a very non-traditional role. But, I grew up in a time when healthcare was revered. The people that did that were, truly gifts from God. And in many ways, I felt that as a calling. I always felt the need to go on and do more and be concerned. And like lots of nurses, I had a life event in my family where I had a grandfather that got sick. And boy, oh boy, were the nurses just absolutely amazing. And it just connected me to something that I knew was going to be more. And maybe history is the best teller of whether or not that was the right choice, because here I stand 30 years later, and I don't regret a day of it. Along the way, nursing has been a complete gift to me and a privilege in my career. But yeah, as a male and certainly somebody from my background, it's a very non-traditional sort of thing to have chosen.
I imagine it was. That's a common theme I hear, both on the podcast and off, from nurses specifically, but really all health workers, that they see this as a job, a career, and a calling, that it's both a vocation and an avocation. They're passionate about it the same way you hear teachers talk about the classroom and education. So it's certainly exciting to see that. And I'd be interested in knowing, when you shared with your family and loved ones that you wanted to be a nurse, how did that go over?
Yeah, nobody really understood where that was coming from, right? I mean, I come from it's truly a bunch of sailors. Have you ever seen the show like The Dangerous Catch? That's what
Yes. Yeah.
folks in my family do for a living. They're 200 miles off the coast of a small province in Newfoundland. But boy, oh boy, did I just connect to something. You mentioned rewards and sort of satisfaction in the job. I can tell you that there hasn't been a day in nursing where the reward was the paycheck.
Right.
Everything I can account for in the blessings of my career have really come through, watching patients triumph, personal success in the role, that sort of thing. But yeah, not one bit of it is really related to some financial outcome. It's
And
really
I'm
not that. It
sure
really
that's
is something bigger than that.
an underpinning passion for you now in the work that you're doing with Health Carousel, and
Yes,
you
yes.
continue to carry that forward, whether you're at the bedside in frontline care or somewhere else positioned in the healthcare ecosystem. Really driving better healthcare and higher quality outcomes for patients is such a common theme. Thank you for sharing that, because I know that's inspiring to the people who are listening. Certainly is for me. So let's talk about the work that you do for Health
Sure.
Carousel. And actually, let's back up a little bit and maybe tell our audience a little bit about your nursing career and how you moved from that into, talent management and staffing support and working for a company like Health Carousel.
Sure, absolutely. So, my nursing career really started with a major decline in the Canadian economy. And so there were no jobs for nurses where I was from. So I moved to North Carolina following friends who had graduated before me. I ended up in the Duke University system down there, where I spent about the next 16 years learning and growing and developing. And I had a great sort of progressive leadership path there. And I really feel in many ways I kind of grew up in the Duke University system. I was
Yeah.
blessed to work there. There was a lot of developmental opportunities, and so yeah, I was blessed to have incredible mentors, people who really took the time to invest in me, and what it led to were more opportunities. And so I branched out and left North Carolina. I spent a little bit of time in Connecticut, and then over to Ohio, where I had a chance to work in one of the bigger health systems here doing emergency room work. And while I was here in Ohio, I had a chance to meet the owner of this company at the time. We got to talking about impacts I might be able to make in a broader, more national group, right? Health Carousel employs nurses all around the country, and that really excited me. And so we took the opportunity to do that. And so, in those days, Health Carousel was a fairly small company, as were many back in 2016 or so. We've grown the company now to about 2,500 or so healthcare professionals on the ground. We serve a global market. We're in 160 different countries where we have some span of influence, and we have nurses in all of the states. So from north, south, east to west, right? I get a chance to interact with facilities and with nurses who are employed to run amongst a range of different occupations within that all over the United States. So I feel incredibly blessed. It's an incredibly diverse role for me, for sure.
That's amazing. So, for our audience, you're really focused on helping international health workers, and probably most specifically nurses, with their career mobility and their skills portability and being able to pursue opportunity, really wherever they want to go in the world, but specifically coming here into the U.S.
Yeah,
That
that's right, Leah.
certainly connects Health Carousel to our business and what we do every day in terms of
Yeah.
credentials evaluation, which is how we have a relationship with you guys. So let's talk about some of the initiatives, the strategic initiatives that you're working on right now. That's kind of the scope, and I know it's broader than just talent management because it's a full scope. What would you say your initiatives are sitting where you are in the business,
Right.
that are top of mind today?
Yeah, yeah. As you point out, we are certainly the number one importer of nurses in the United States. We're the number one international staffing company on measure, far and away in the United States. And so we transact a lot of work for nurses entering into the United States from, as I mentioned, right, well over 100 countries. And so things that we're working on, right, are centered on really the well-being of the nurse, right? In many ways, we consider ourselves a social enterprise, right? So we do good in the world when folks are doing good,
Yeah.
is how we certainly look at it. And so we look at that in a couple of different dimensions. Right, first off, there's an incredible level of trust a healthcare professional places on us to uproot away from their families and their social systems to come to the United States, right? And so certainly one of the higher focuses of my role is to make sure that those nurses have a great experience, they feel safe along their journey, and that they get a chance to grow and develop, right? It's not near as transactional as it would seem. We want those nurses to have very fruitful careers
Right.
well beyond any interaction with our companies. So for me, there's making sure nurses are prepared to come to the United States, right? The healthcare system is different. It has regulation, it has oversight, it has a lot of rules, as everybody knows.
Yes.
And so making sure nurses are prepared for that as they come to the United States is an important part of my role. Secondly to that, is the nurses' development, right? We want nurses to think well beyond their arrival into the United States about what will you become, what do you want to do, kind of when you grow up in nursing. Right now that you're sort of realizing your American dream, right? How do we help you reach for the stars? So I've been really proud of our careers work. We call it here at Health Carousel over the last couple of years, where we're really helping nurses have career development plans and connecting them to resources that really make them the most versatile versions of themselves that they can be.
Yeah.
And I would add there, Leah, that the third component of that is also, and this is incredibly important work for us, is that we understand there's a country left behind. Right, that there is a group that this nurse is emigrating from, and so we certainly are deeply invested in the nursing infrastructure within the countries in which we partner with,
Yeah.
to make sure that we sort of leave this state of affairs better than we found it
Yeah.
when we started. For
We're
the
going
most
to
part.
jump in on that here in a few minutes
Yes,
because I
yes,
think
I
that
know
is
we are.
probably one of the most, if not the most interesting topic that we could spend a good bit of time on today. I do want to talk about ethical recruitment because I know that you guys have made a public commitment to ethical recruitment, and Health Carousel is part of our alliance and certified as an ethical recruiter. What does that commitment mean to you, to your company, and to you personally? What does that look like practically in the way that you operate your business? Because I think outside of our ecosystem in this environment, people might not be aware of that concern and why it's so critical,
Right.
and maybe how problematic it is. And I know you guys are proactively addressing that. If you could touch on that, I think that would be great.
Yeah. Yeah. Thanks for the question. So, I would tell you at its core, the thing I'm most proud of in this is that, the sort of statements that we're an ethical recruitment company are fine, but these are done on measure. These are done through, certainly the Alliance, right, for Ethical Recruitment, of which CGFNS is a part of. But more than that, it's Joint Commission. More than that, it's places like Ethosphere. It's AAIHR, right? These are places that, on measure, come into your organization, and in a real way, where you can't just make up the words. Right, it is a measured piece. So I'm incredibly proud that we have achieved, the sort of certification statuses of those organizations, who on audit, right, on a real thing, come and do that. But more than that for us, right, it's a way of doing business that is just sort of part of the DNA, right? It is incredibly important to us that the right thing happens. Right, and the right thing that happens isn't necessarily the right business thing, right? That sort of thing, right? And so, right, we certainly do pay attention to things, for example, like the WHO safeguard list, right? There are lots of countries in the world that need their own healthcare infrastructure, and they don't need companies in there recruiting away what is needed within the country, right? So, one of the sacred pieces within our operating list is that we will not, actively recruit out of companies, out of countries that are on the
That
WHO
are
safeguard
on
list,
that
et cetera,
list.
right?
Yeah.
And so, it's really a way of doing business that is culturally bound to let's have the right things happen on every episode, right? Every single interaction of interaction with the healthcare professional.
Wonderful. Thank you. All right. Well, let's talk about um, the focus, and you mentioned earlier on what you invest in those, what we would call sending countries or the source countries where these health workers are leaving and coming in to pursue opportunity in the U.S. I know that you guys have a commitment, and when we talked before this podcast, you said Health Carousel's goal is to leave a better than carbon neutral footprint in the
Right.
sending countries. What does that mean? How would you explain that to our audience?
Yeah, yeah. So, really, and again, right, this we're talking about people, so it's not as easy as talking about trees. But if you take a tree, plant two more, right? It's certainly the concept that we started with, right? We want to leave countries with their own infrastructure in a stronger place than before our interaction. So through our efforts, and I'll get into a little bit of how that goes. In 2024, we added to, and I wrote down the stats here, so I wanted to make sure I get these things right. We've added to the supply within their own countries, right around the world, to the global sort of nursing supply. We've added over 1,500 nurses, and I'll explain sort of how we got there to do that sort of thing, into the global supply, a number we're incredibly proud of. And when we started this work, we didn't know how far we would get, but we're incredibly proud of that. And in addition to that, we've added over 36 100,000 hours of training around the world. And those two things for me sort of go hand in hand. So what do I mean, and how am I coming up with those numbers? So if you look at the Philippines, for example, right, a very common place for immigration,
Yep.
the national licensure exam they have to take in country has about a 50% pass rate. At times, not even so, right? It's 48, 50%. So we invested in educators in the Philippines because you get a multiplier effect. If you create a better educator, you create better students,
Sure. Yep.
right? And we measured how those educators were preparing students for the NLE exam, the National Licensure Exam in the Philippines, and then we measured the success rate. Of those students who took the exam. So the success rate, take a month here, right? The number moves around a little bit, but it's around 70% or so for us, right? So, sort of left to the infrastructure of the country, right? Their pass rate for NLE exam licensure is around 50%, 48%. And through our direct efforts, we're able to measure a much higher success rate for those students. So we've taken that model and really applied it around to countries, say some of the African nations, and certainly the Philippines. And what we're seeing is that we're able to contribute back to the sort of global supply, right? Separately from that, and I was sort of embedded in that answer was then it's important to target who will you train and develop to offer the most assistance there. And we have a strong belief that we get a great multiplier effect out of really focusing on educators and leaders, right, who can affect large cohorts of people. So we invest a lot in leadership and educational training to educators and leaders as a mechanism to affect the most people we can to a positive
Well, and
outcome.
not only that, when we talk about global critical shortage of nurses, we're not often talking about maybe enough that is even more impacted at the academic level. We're not seeing nurses move into that education role and the numbers they might have in the past or are aging out. And so investment in education and training is as critical for shortage as it is for capacity building. So
Yeah,
kudos
you
to you
you
guys
just
for
you
doing
just
that.
nailed it, Leah. That's exactly right. Right there, that is sort of the choke point, right? And it is early identified spot for Health Carousel. That is a place that we certainly do add a lot of effort.
Yeah. So can you share some examples maybe of, I know you shared the Philippines as an example. You are doing something, I believe, in Uganda, right?
Hmm.
With
Yeah,
specialty training for critical care.
yeah.
So that would be a great example to share with the folks.
Absolutely. Yeah, we're really proud of that work. And so, and I think we're going to get to this in a minute, Lisa. So I won't go deep on this part, but one of the initiatives we started around the world is to also elevate the image of nursing
Yeah.
around the world. Because as you know, outside of the United States, nurses have a varying degree of image throughout the public.
Yeah.
And so we embarked on a journey with Uganda to deliver Daisy Awards to that country to recognize nurses for the hard work they do, right? Because it's just incredible,
Yeah.
the conditions some of those nurses are working in and the outcomes they're able to produce for patients. And so on this journey, as we're working with government and government officials, the conversation kind of led into, well, what else might we do together for the benefit of nurses? And so what came out of that conversation was that in Uganda, like lots of African nations, nurses are graduated as generalists. They
Yeah.
don't have a lot of specialty trained on any specialty, really, of nurses, right? And so, basically the soundbite that really captured my heart was, we have people dying in ICU every day because we just don't have the training to pull them over the line, right, and get these folks better.
That's powerful.
Yeah, right. And so what I have access to in the United States is really the gold standards in ICU training, right? That we have access to vetted content by high-level professionals, and we have a vehicle in which we could transmit that information through Health Carousel to really anywhere in the world.
Yeah.
So we partnered with Uganda in one of the major hospitals in the capital city there, of Kampala, and we built them a computer lab. And we put 20 computers in this computer lab, and then we worked with the Ugandan government to get a cadre of students that would be our first cohort in ICU training. And then over the next year, we trained those nurses in a sort of thoughtful methodology on how to be better for our ICU nurses. So what's really cool was last year, coming into the end of 24, coming out of 23 into 24, we went over there and celebrated with those folks the first graduating class out of this work. one of the major universities in the area has picked up the curriculum now as a post-certificate graduation course that folks can basically go back to university and do. And now we've got this group of 20 nurses who become the future preceptors on out
Right.
for others, right? So
Yeah.
we've really kind of planted a seed there where now they are picking up the training. They're training future cohorts, right? We've partnered with them now to train 50 more nurses in 2025, and so we're working through candidacy and the selections for that course. But we've got
Excellent.
this incredible groundswell of folks who are, who are now trained and now training future ones, and we're just incredibly proud of
Well, and the
that work.
potential to replicate that with other special nursing specialties and specialty care, especially to build capacity, and like you said, future educators and proctors and things like that, I think is tremendous. Out of curiosity, were you using simulation in that lab? Was any part of that training using sim?
So the part we provided was really theory and more didactic, right? But
Yeah.
understanding the need for preceptorship, right? We had, in fact, some of the doctors in the country say, "Hey, listen. So for every, like when they did the cardiac system, for example, right? They went to the hospital and worked on real patients and
Wow.
got the practical experience. So we didn't sim it in a traditional sense like we would think about it in the United States,
Yeah.
but we had a practical portion
Well,
built
that's
in.
even better, really.
Yeah, right. So like they would go
Yeah.
do shifts in the ICU and
Yeah.
actually, use the information they learned the day before,
We're
right,
seeing a
to their
lot of
benefit.
interest in countries where this same challenge exists for bringing in simulation capabilities and doing some
Hmm.
training that way, especially if these health workers are not within a drivable distance of being
Yes.
able to do clinicals and hands-on learning. So I was
Yeah,
curious if you
we
were
certainly have a
incorporating any of that.
roadmap there, Leah, and that's on the roadmap, right? I think there's actually a place here for virtual sim
Yes.
and that sort of thing, right? And
Yep.
so we are deep down that road as sort of version 2.0, right? Like
Yep.
how do we keep this going to reach even more? So yeah, you're dead on point. That is, it's funny
Those
how
are
that sort
we
of
should
goes,
talk about
yeah.
for
Yeah,
sure.
one thing slides to the next, but yes, that is the roadmap, right? We have more countries who are like, yes, this is good. Can we avail of, right? And so we're
Yep.
certainly in discussions there. And then what is the delivery method of some of that education, right, to make it an enhancement from where we started, right?
That's
That is
excellent.
certainly where we're at.
You mentioned Daisy Foundation. We're, as you know, partnered with Daisy Foundation on an Ethical Recruiters Award now every year, and of course, so everyone's so proud of, and their work is so well known for recognition. So that work there, I'd love for you to talk a little more about some of the celebrations that you're doing, the kind of awards that you give. And I think we're gonna see even more come out from the WHO here in another couple months when the State of the World's Nursing Report comes out. I know Howard Catton was on our podcast a few weeks back talking about how one focus of that report will be on recognition, and how critical that is to addressing nurse burnout and turnover and career advancement and mobility. So you guys are already really plugged in there, especially in Uganda.
Yeah.
What does that look like, and how do people respond to that partnership in the countries where you're bringing those programs in?
Yeah, yeah. So I would just start with the incredible pride we have in our partnership with the Daisy Foundation. We've got an international advocate program that we launched with them, where really the whole work started, right? Although it's branched into these other things around recognition of nurses around the world for the hard work that they're doing,
Yeah,
and raising the image of nursing around the world, which we alluded to is
yeah,
not necessarily stellar, depending on the country you're in, right? It's not considered the job to have, right? That sort of thing. And if you think about the incredible work these people do, right, and the calling they have, it needs to be better. So that really is one of the primary goals for Health Carousel. Would be that part right there. So through the Daisy Foundation, we have partnered into several countries. So this would be Philippines, Senegal, Ghana, Kenya, UAE, and I could go on and on. And we've given, in excess of 100 awards, where it really comes one of two ways. We're happy to go sort of be the front headliner and give the award and make that connection in those moments.
yeah,
But we actually like doing more is having governments and official bodies be so we'll underwrite the award and sort of sit in the background,
yeah,
and sponsor all the way through, right? Not only the hardware of the award, but the nurses' time and cost to travel to a city where they're going to be recognized, And in particular with Uganda, when we started this, we started with 24 awards, and the president of the country came to this huge celebration that, again, we sort of underwrote at Health Carousel, right, to be good actors, but we wanted them to be in the place where they were recognizing nurses and, talk about just a heartwarming moment to see those nurses who, like every nurse, just says, I'm just doing my job, right?
Yeah.
That is the most common answer that nurses give, right? But what they're doing is not ordinary. It's extraordinary, right? It's extraordinary work. And so we're incredibly proud of that. And so every year we continue to partner into governments and official bodies in certainly some of the African nations and around the world to continue to try to elevate the image of nursing as we go.
We're finding that as well with the Recruiters Award, that administrators and colleagues, they really want to be part of that acknowledgement process and letting them kind of take the lead and us stepping back and sponsoring that award. But, the nominators want to be part of that as much as the nominees do, because they've been so impacted personally by that individual and their care. So.
Yeah. And if you think about a global shrinking supply, right? I mean, just on the face of it, right? Could there be a more pertinent topic than us taking care of one another and recognizing one another? Right. When you look at, a shortage coming up towards the end of the decade, somewhere around half the amount of nurses that we need around the world, right, won't be there, right? And so, we need to do a better job of recognizing the incredible efforts that these people give to the contribution of the well-being of others.
Absolutely. Well, that just
And so
underscores that number that you just shared. And I suspect, again, in this report that's going to come out from WHO, we're going to see the criticality of those numbers even more poignantly.
Right.
So all of the programs that you're investing in, recognition and capacity building and training, are really aimed at raising all boats in the ecosystem and supporting, infrastructure development in these nations where that criticality is so important. And we hear it too. I'm sure you guys do. We hear a lot about brain drain and the flight of skilled workers to other countries, and there's very nuanced economic issues around all of that. Of course, we are sensitive to those as you are, and we support primarily the goal of having health workers be able to pursue opportunity in the world and pursue career mobility how they need and want to for themselves and their families. But it's still a complex issue, and it's great to see that companies like Health Carousel are mindful of all of the complexities that are involved in the global movement of health workers. So kudos to you guys for really taking that seriously and addressing it with critical programs. I think it's great.
Yeah. Yeah, I would say to that, right, that there's a couple of pieces here, right? One is people reserve the right to have free movement around the world, right? And so a person deserves, right, the right that they have a craft to do that craft in here to Australia, right? I mean, they really do that, right, as long as they meet the rules and can travel freely. But more than that, aren't we moving into a global community where there could be a catastrophe over there? Why would we limit people from going there to help out? It could be a catastrophe over here, right? I mean, we saw that within the states with COVID, right? Where executive orders had to be written so that nurses could jump borders one state to the other to practice, right? And doesn't it make more sense to have a global network where people can go where the work needs to be?
Not to mention the changes that needed to be made so you could provide care virtually across state lines. And we would like to see. We think one of the ways of addressing some of these needs is to bring in more virtual technologies, telehealth, remote patient monitoring, and train up the global workforce to use those technologies and be able to not only themselves move their careers, but to be able to provide care into high need, low access areas from anywhere in the world.
That's right.
Using technology. So are you
I
guys
think that's
looking into that as well as part of your delivery model?
Without a doubt. Yeah, without a doubt. There's sort of a whole 2.0 here, right? Like you kind of learn what you learn as you go through this first time, but like even as I referenced the Uganda work, right? I mean, there's places there where right, we really could be parachuting training and with a whole nother level and layer to prepare those people. And what are the spin-offs of that, right? They would learn how to do this on their own. What are the applications to patient settings,
Yeah.
right? I can just see how that becomes a slippery slope where people end up in a whole different place on levels of application of care.
Yeah. Yeah.
Right. And boy, oh boy, is that that's the next exciting piece, I
It
think.
is. Yeah. I mean, we've certainly seen those discussions just here around the rapid adoption of telehealth that we saw during COVID, right? I
Mm-hmm.
mean, it was an absolute necessity. All the waivers that enabled that to happen and enabled clinicians to diagnose and treat virtually across state licensure lines and that kind of thing. And there's certainly a lot of advocacy to keep that momentum going. But I think the same concerns that you just raised we have to keep a watchful eye
Yeah.
on the quality of care and
Yes.
the equality of care that's being provided through
That's
those
right.
means into every community. So it's a great point that you raise. All right, we are almost at the end of our time. I want to throw out one more question to you. What do you tell the global nurses you work with about the future of healthcare and how to prepare for it, no matter where they are or are moving to? And where they're going to choose to work. Are you hopeful for the future of healthcare delivery, and what do you tell them about the future?
Yeah, honest to God, I think our future's never been brighter. Right, the people that are in healthcare are in it for the right reasons, and I
Yeah,
see this around the world. Right, I don't hear anybody really talking about a paycheck and all of, what my bonus is going to be. Right, what I hear every day when I talk to nurses is the concern for their patients,
yeah,
the concern for their coworkers and their peers, and they just want to do better. Right, where we're convicted on this and really have developed a stance over the last couple of years is they're so selfless. They're not even really thinking about their own careers and where might they take it. And so, as you think about that ecosystem, where do you want to fit in it? Right, and where there's a lot of off ramps, right? There's a lot of ways that you can be
yes,
involved in divergent business activities, right, that support patient care, right, like virtual nursing, etc.
more than ever before for
More than
nurses.
ever, right? And
Yeah,
when you're in that forest, I don't know that they always can see it. And so we've really embarked on a mission around let's help nurses see career path. Let's help nurses connect to, like if you want to be in a certain place in 5 years, what are the steps you have to take to unlock
yeah,
to really get there? Because you can and you should. And I'm just not sure that nurses are so in the weeds of taking care of patients and each other
yeah,
that they're selfless about it, right? And there's a lot of self-sacrifice, and so this certainly has led into the last couple of years around mental health and resiliency and those sorts of
sure.
things. But
Yeah,
the deeper piece really is it's how selfless this group is. So I think the future's bright. We have an incredibly convicted workforce that are in it for the right reasons and taking care of patients. And I do think ingenuity born out of need will get us to better places. I worry about nurses not looking at their own careers close enough to figure out how they can participate to get there. And that is certainly a mission of mine in Health Carousels, is to help them broaden their horizons and scope. Like, why not you get the master's? Right.
absolutely.
And
Yes.
be part of the decision-making team that's doing these sorts of things, right? Or the
Well,
doctorate.
and instead of having your career happen to you and kind of sweeping you along, making proactively deciding that career path and
That's exactly
recognizing,
right.
like you said, there are so many options than bedside care. Not that that's not a great
Right. Right.
place
Amen.
to be, and certainly critically needed. But look, I mean, look at the role that you're in.
Right. Totally
That's
non-traditional. In every sense of the word,
non-traditional.
it's non-traditional,
Yeah,
right?
that's why I love talking to nurses who are in strong leadership, influential roles in industry, because I think it helps nurses coming up and other health workers to see, oh, there are a lot of options for me. I could work for a tech company
Hmm.
developing the future of immersive bedside technologies for patient care.
Yeah.
I can work in academia. I can become a nurse. I can go into research. I can go into workforce development
Hmm.
areas of the world. And so I think it's great that you guys are proactively recognizing that nurses might need to lift their heads up a bit and see the long-term view of their careers past those early few years when they're focused on getting into a hospital and getting on shift and administering hands-on care. That there's a lot of I think there's more opportunities for nurses, but also, and we don't have a lot of time to dive into it, just politically, in terms of shaping the future of care models and policy at a very high level. I think nurses have a stronger
leadership voice at the table than they've ever had in the past, and continuing to grow, which I would be encouraged by if I was a young nurse coming into the profession today.
You just hit the nail on the head, and certainly organizations like AONL that have Advocacy Day and those sorts of things, right? But right, if you think about it, nurses in many ways have a large voice inside the hospital about the care of their patients, and why wouldn't you echo that to the larger policy discussions, et cetera, right? And have that sort of same voice in a more macro environment around the geopolitical climate in the country, right? Because they need our opinion, and there are certainly lots of opportunities, I think, to do that. Lots of organizations have advocacy arms, but if your voice is that important inside the hospital, imagine how important it is, right, to those who have they don't have the education that you do about how healthcare goes.
I would really love to see that replicated in other countries, and showing nurses that collectively, and I know that's a lot of the great work that ICN does as well, but that collectively you have the ability to come to the table politically and influence policy at a federal level, at a regional level, within your own health system. You have more power because of the critical role you play. I mean, there isn't a larger profession in healthcare, and I think maybe in the world, than nursing. So it's quite a position if you recognize the power of it.
I would even accent that, Lea, with not only is it the largest profession, there isn't anyone who spends more time with a sick person than the nurse, right? It really is, right, in acute care, right? It's certainly a 24/7 thing, right? So who better to offer an opinion about what is needed than those who spend the most time suffering with you, holding your hand, right, taking care of you, right? And so not only is it a big workforce with a big opinion, boy, oh boy, are they close to the work.
Absolutely. I think that's why we're in the last probably 5 to 8 years, because I come from the health IT space before I came here.
That's right.
We're seeing tech companies pivot to hiring more nurses, advanced skilled nurses, to come in and help develop technologies, because they actually understand what the user experience is going to be and what it needs to look like to actually be successfully deployed in care settings.
Yeah, and I would, just as a small plug, I would think about things like Nurses on Board's website, nurseonboards.com, right, where companies are seeking, through the great work of that organization, right, to put nurses' opinions on their boards. Some in traditional business space, right? Some of them are not in traditional space, but they recognize the power and value of nurses, right? J&J's great work around hackathons and let's get a great idea from a nurse, right? Because they know, right? Because they're so close to their work. So, right, the opportunities abound there, and I won't, sort of go off on a tangent on this, but there are lots of ways to branch out here and find a way to be active and be part of it.
Well, thank you so much for joining me today and sharing all the great work that you guys are doing at Health Carousel. Very proactively engaged in so many things beyond just talent management, which is great. And I think it's important for people to know that. I certainly appreciate you taking time out of your schedule to hang out with me today, and hopefully we can have you back in the future. Really appreciate you. Thanks so much for sharing your time.
Thank you, Lee. You and your team, you guys have been great to work with, and preparing all the way through this. So it's been a deep honor. Thanks for having me on today.
Thank you so much. All right, everybody, that's the end of this episode of Care Anywhere. We'll see you back next time. That's it for this episode of Care Anywhere. Thanks for joining us. We hope you'll tune in for future episodes where we will continue these powerful discussions about our global health workforce. If you missed any episodes, you can find them at trumerit.org/podcast, or by subscribing to our channel on your favorite podcast platform. Just look for our podcast logo or search for Care Anywhere to find us. Thanks again, and we'll see you next time.